Hey everyone, welcome back to the channel. Today I thought I'd talk about AC joint injuries. It's something we don't see in the clinic too often, but they definitely do happen and are pretty common. And I think probably one of the most common things people describe is a feeling of dislocating their shoulder. So I've had a few players who at soccer they've fallen over, hurt their shoulder, they've run over the sideline, they're like, Murray, I think my shoulder's dislocated. And you have a bit of a feel like the glenohumeral joint, the main part of the shoulder, is definitely in the socket, but the AC joint feels like it's separated. So, this is commonly what people might sort of call a separated shoulder. Um, yeah, it's a really interesting condition. So I guess the basics, your AC joint sort of sits on top of your shoulder. So if you've ever seen a bunch of cyclists who's been around for a long time, they've got a big bump up there. They've most likely injured this part. And it's a pretty important joint because your shoulder blade doesn't have any bony attachments to your body aside from this joint, compared to things like your hip and your knee and your wrist and all these sorts of things which have really firm bony attachments. So with that, it takes a lot of force when we weight bear, such as like push-ups or pressing overhead or having to get up off the ground. So I guess the two types of injuries we see with AC joints is sort of one like an acute, so they fall. Now typically that's sort of landing on the point of your shoulder, so as you hit the ground, you sort of make that impact, and then the bone sort of gets lifted up from the top. The other type of injury we see is sort of chronic, so a bit of overuse. So we often will see that in swimmers or weightlifters who are doing a lot of horizontal plane work. In the case of weightlifters, often like dumbbell work overhead, and the repetitive trauma of the dumbbell onto the ligament can actually cause some damage. I guess in terms of grading, you've sort of got mild, moderate, and severe. The severe ones look very obvious because you have what we would call like a very big step deformity on that top bit. And typically you don't often end up with us here in the clinic. You've often taken that straight to the ED yourself. But in terms of the mild ones where there's just a little bit of separation or there's no separation at all, but just a tendon ligament, physio can be really helpful. We'll send you for an x-ray first up just to make sure there's no fracture in the clavicle or the shoulder blade. And that can also help measure our separation. And then I guess coming back into the clinic, depending on the severity, we may put you in a sling just to help it rest for 1 or 2 weeks. Often we'll strap that shoulder so that the AC joint is sort of strapped back into position so it can heal nice and closely and feel really stable again for you. In terms of the grade 3 injuries, you can leave them sometimes, but if you see a surgeon, they might offer you a reconstruction of this where they'll either just tighten the ligament or they'll put a pin in to make sure that the joint's really stable. I guess in terms of what we do for physios, in terms of your rehab, is just calm it down. So we just give it 1 to 4 weeks, depending on the severity, to let it calm down. And then just a progressive strengthening program to help return you back to your sport. Amy, one of the therapists who works with us, she makes AC joint pads. So out of hard thermoplastic, she can make a pad to sit over the top of the joint, which is something you see a lot in the contact sports where due to the tackling, the AC joint is predisposed to a lot of pain and injury in there. So having that sort of padding can be really helpful. So if you've got an AC joint injury and you play rugby league, come in and Amy will happily make you one of these splints so that you can get back to those sort of contact tackling sports without as much pain. So thanks for tuning in, guys. I hope this information was helpful and, now you can understand a bit of AC joint injuries. Give it a share with some of your friends, give us a like and a follow, and give me a yell if you've got any questions.